identify the root causes, it's going to be the only way you will know what to do to heal your body. And that's the flaw with conventional medicine is that we, the people in the conventional medicine, do not know why they are feeling the way they are feeling. They don't know why they have the lack of energy or chronic fatigue, why the autoimmune is in existence, why they have chronic health conditions, why the hormones are imbalanced, why they cannot lose weight, why they have brain fog, why they have acne, psoriasis, why do they have infections? They don't know because the number one concern in conventional medicine is to give you a pill. Conventional medicine doesn't really focus on identify the root causes. So, hello everyone, welcome back to another lesson. I'm Dr. Jennifer Genti, functional medicine, and I specialize in gut health, hormonal imbalance, and weight loss. And in today's lesson, I'm going to answer the most common questions that I get when I tell patients you need to identify the root causes. And I'm also going to share some tests that I run in my own practice here. We have a clinic in Denver, New Jersey, Wellness Corner NJ, where we help patients identify the root causes to give them clarity and also to show them what they need to do in order for them to feel great. And all health issues, I believe once you know what's causing the health issues, including cancer, you can eliminate it. If you don't want to be put on a medication or you want to get off the current medications you are currently on right now, you need to identify the root causes. If you want to have a thriving, growing, healthy body, you need to identify the root causes. So when I tell patients, what are the root causes of whatever symptoms? And they will always tell me, I don't know. Well, did your doctor go over the results with you? Well, the results are normal, Dr. Genti, but I still don't feel normal. I still haven't had flashes. My skin is not clearing up. My hair is falling off. I'm bloated and gassy. I don't know. And I've seen all the experts, the GI doctor, the dermatologist, the neurologist, the endocrine doctor, my hormones are out of whack. I don't know. And then they will ask me the next question. Since I know I need to identify the root causes, how do I do that? What exactly do I need to know what my body is telling me and to also assess the health of my cells? Because this is a cellular process. So therefore, if you want to heal your body, you need to address the cells. So today, I'm going to show you exactly what you need to do. And I'm going to share my screen. So in the world of medicine, you need to do two types of testing. You need to do conventional testing and functional testing. Conventional testing, that's when we are assessing the things that are outside of the cells. We call that the extracellular testing. And that is why with conventional testing, many of the results are normal. How many times have you gone to your doctor seeking help and you want a solution to your problem and you want to feel great and you're struggling? And then they will tell you, well, according to your blood test, you should be fine. And that makes you feel a certain way. That makes you feel that it's in your head and you're crazy. And if you keep going to that doctor's office over and over again, they will definitely refer you to a psychiatrist or they will give you Xanax because conventional testing doesn't really show the true picture of your health. And if you don't know what's happening, the underlying conditions at the cellular level, you will not, my friend, heal your body. You might try certain things and then plateau. So that is why we need to also incorporate some functional medicine testing. Functional medicine testing is assessing the intracellular, the cells, the function of your cells, because your cells are like little tiny workers that work for your body to help you heal at the deepest layer or deepest level. So conventional is the surface and functional is the deep layer. We need both. I do both in my practice because there's certain markers we can extract from conventional that we cannot extract in functional. And conventional testing is covered by insurance, so why not? Functional medicine is not covered by insurance. So we pick both. But you have to work with a practitioner that knows that is sound, that have been doing this work, like myself, been doing this work for 11 years, that can pick and choose the right test for you because we need to also look at the financial piece. We don't want to order tests that are like $4,000, $5,000. To me, that's a little extreme, but be mindful that you will need to make that investment to really know what is happening, to actually have a plan that is customized, individualized to you to heal the issues. So I'm going to show you what I use in the conventional arena when it comes to testing, and the 3 tests that I highly recommend in the functional, and what I'm looking for when I recommend those testing. Now, I can do another video to go much deeper into each test in the functional medicine testing so that you can take that information and bring it back to your doctor, depending on how you feel. But you need both. If you only focus on conventional testing, trust me, that's not even half of the puzzle. You're going to be struggling. You're going to be frustrated. You're going to get anxious. You're going to feel like something is wrong with you. The problem is you, because every single doctor in the conventional space will tell you there's nothing wrong with you. So please, if your desire is to find the solution, which it should be because nobody likes being sick, you must incorporate both testing. So now let's look at the lab. I'm going to share my screen. We're going to look at some tests. All right. So the one that I'm going to share with you is real patient, my patient. She gave me a testimony so I can share her results with you. But take a note, a pen and a piece of paper and write everything down, because this is going to be very important for your healing journey. And it's going to be very important to have this conversation with your doctor, because doctors don't know what they don't know. But if you bring it to them and say, hey, I think we should be testing for that, you helping your doctor help you. So that is why knowledge is so powerful for you to learn about yourself, your body, the communication system, and also use that energy, that open-mindedness to receive. And then that's how you're going to find this information. But if we are close-minded, we're in our little bubble, we only focus on conventional medicine, then you might miss the opportunity to learn about something that might benefit you. So the first one I'm going to show you is a LabCorp. LabCorp is a conventional test. Diagnostic, cross diagnostic is a conventional test. Anything that is assessing the plasma of the blood, not the cells, we call that conventional testing. So you see here, this patient came to me with a lot of digestive issues, a lot of gastric issues. Oh my God, like the bloating, the gasiness, abdominal pain, chronic fatigue, the brain fog, and the skin issues. And you can see she has Coxsackie. So I do a gut panel to LabCorp, which is Coxsackie, Epstein-Barr virus, cytomegalovirus, parvovirus. And we also can check the lipid panel. We also can check your iron to LabCorp. There's a lot of markers, anti-inflammatory markers we can check from LabCorp. And also tumor cancer cells, we can check the LabCorp as well. Your thyroid antibodies can be assessed to LabCorp. So we can use LabCorp for what it can provide us, and then use functional testing for the rest. So this is one of the tests. Ask your doctor to do a gut panel looking at the viruses that have been dormant and silent inside of your gut. So that's one way to identify the root causes of your symptoms and your disease. The second test that you need to do, depending on what you are experiencing, is a hormonal test. If you have PMS symptoms, you get hormonal acne, you get headaches when you're going through your menstrual cycle, and you feel bloated, like you feel like something is happening to your body, something is shifting, right before, a week before your menses, you need to check your hormones. If you're on birth control pills, you need to check your hormones. If you want to get off the birth control pills, you need to check your hormones. If you're peri, and postmenopausal, we need to check your hormones. But in the conventional space, we are checking hormones through blood, which is not the right way to check hormones. We need to do saliva or urine, depending on your diagnosis. For my patients, for endometriosis, we do urine metabolite, and I might do saliva. So, but for majority of my patients, we do saliva. Because the saliva, not only it is cost effective, but I can extract the most powerful hormones that are causing havoc in our body and to give us the solution. This is ZRT, that's the company that I use, saliva test. This is an example, a report. You can see we're looking at estradiol, progesterone, the ratio of estradiol, progesterone, testosterone, DHEA, and then all the cortisol for a full day. And they also tell you what the range should be. I use that information for my patient. And it gives you it asks you to put all your symptoms and how you feel. And then it also gives you a little information about each hormones, why you might be into estrogen dominance, estrogen deficiency, or progesterone, what is happening with progesterone, testosterone. And then for cortisol, it also tells you some of the health conditions, risk that you might experience with having high cortisol, low cortisol. Cortisol can definitely affect your immune system. A lot of people get infections, viral infections, bacterial infections when you have low cortisol or high cortisol. If you look at all the people that are burnt out and overwhelmed, they always get sick. They always get a cold. They're always under the weather because the cortisol is so high that it's literally decreasing the immune system. And it tells me exactly which time of the day your cortisol is high or low so that we can support your adrenals specifically for that time of the day. All right. So everything you do to your body should be intentional. So that's another test. If you have sleep issues, we can test your sleep. Again, we do urine. I can look at your free cortisol because cortisol can literally affect your sleep. All the people with sleep apnea, insomnias that are taking medications right now, they don't really need medications. If they can, look at the hormones that are affecting the sleep. We look at free cortisol and we also look at your melatonin and creatinine. You can see if it's high. If these things are high, you're not sleeping. So what do? We support your adrenals. We support those hormones and make sure they have a healthy dose. Your body has a healthy dose. I take people off sleep medications when we do this all of the time because sleep is needed for your body to rest. If you're not sleeping, you're not healing. It's like your body's been driving for 24 hours, 7 days a week, and you have your mind is racing. And then when you go to your doctor, they do crazy tests like sleep studies and you get put on a machine for sleep apnea. But the simplicity is fix your hormones, balance your hormones, identify the root causes, look to see what we need to do to get you some sleep. And then of course, you get tired in the morning, you get sluggish, you're not performing at your best. So it gives you a little education of the difference between free cortisol and cortisone, because it might be new. This verbiage might be new to you. And you get to educate yourself and get off the Ambien, get off the trazodone, get off all the other medications that are your body's not loving, that are attached to side effects. For weight management, this is a test that I do for weight because when it comes to weight loss, we have to look at your hormones. We have to look at your vitamin D. We have to look at your insulin. We have to look at your hemoglobin A1C. We have to look at your toxicity level. We have to look at your cardiovascular aspect of weight. If you have high lipids or high cortisol, you have fatty liver disease. Your liver is holding onto the fat. It's not releasing the fat, so you're not losing the weight. So there's a panel you can do to assess all of that. Taking semaglutide or GLP-1 is fine if that's what you want to do. But again, identify the root causes of your weight gain. We need to do that. And then other testing that I do. So this is a mold toxicity panel that I run on many of my patients, specifically if they have skin issues, they have weight issues, or they are sluggish and tired. I check for mold. Or autoimmune conditions, any autoimmune conditions, we check for mold. It is a given. So you can see mycotoxin is produced by mold. What I bring to my patients' attention is that many of these mold are acquired or you are getting them from food. So that's why dietary changes is vital. Like I can do a whole video about this test alone because you get at least 26 pages of all your toxins to help you see what you need to eliminate. And what I love about this test as well, it tells you exactly the disease that are associated with each toxins. If you come to me have gut issues and you have aquatoxin, you can see, right? Like gastrointestinal issues, small intestine issues that are associated with this mold toxicity panel. And of course, the food that we've been eating that we're not aware of, that's actually feeding the mold, producing the mold to our bodies. And they also give us generalized recommendations what to do because it's always to detox. You have to find the best detox program for you. My total body restoration program happens to be so effective for my patients to help them detox and remove some of these mycotoxins, heavy metal toxicity, and environmental toxicity. So this is all the mold, and it's going to tell us which mold you get from your house, which one you get from food, and what food you need to eliminate. And then this test also evaluate heavy metals for all of us with cardiovascular diseases or autoimmune conditions. Again, autoimmune conditions keeps coming up. If you have heart issues, look for heavy metals. If you have muscle cramps, kidney disorders, look for heavy metals. High blood pressure, low blood pressure, energy issues, look for heavy metals. Headaches, like heavy metals. Thyroid issues, heavy metals. Lung issues, cancer, heavy metals. So you can see here arsenic. It tells you how you can get the arsenic in your body. You can inhale it. You can eat it. You can get it from water. You can get it from exposure to your skin. And it tells you associated risk. I love this test. All the symptoms here. And then, of course, what you need to do to eliminate this arsenic out of your body. which is chelation therapy. Always. So heavy metals chelation therapy is effective, which is an IV that we do here in our clinic. But again, you have to write with the doctor to get the right dosage for you, to also get the right recommendations for you as well. This also gives you environmental toxicity. Many of us don't think we have environmental toxins in our bodies, but your toothpaste, your soap, your detergent, your personal care products, your household products are literally introducing this into your body. Again, it tells us the background. It tells a little bit about the environmental toxin. It's man-made, the risk associated with these toxins, and also possible source. So how did you get into your body? And then what to do to get rid of it. Isn't that easy? Like the solution is right there, my friend. Like we don't need to complicate things. Why are we complicating things? The solution is right there. But yet many of us are struggling because we're not getting the right guidance, the right support, the right test. You have it right here. So that's the test that I do a lot. I am a mold expert in the state of New Jersey, kept my certification in mold. So I do a lot of environmental toxicity, heavy metal toxicity, mold, or mycotoxicity work every single week with my patients. Chronic fatigue, autism. If you have autism, my friend, or dementia, you see this? You need to check for environmental toxicity. And this toxin right here happens to be very, very important when you want to eliminate seizures and you want to improve heart functions, when you want to feel better, you want to have that cognitive function, these toxins need to be evaluated. So I can go on and on and on. And then the next test I'm going to show you is nutritional deficiency and also checking the gut cellular function as well. So this test is so important. If you want to replace your medications with vitamins and minerals and amino acids, it's NutriEval. This is assessing your deficiencies at the cellular level. Many patients will come to me and be like, I'm eating the food, I am not digesting, I have malabsorption. This test is going to tell us what you need. So like with all the other tests in functional medicine, it gives a little bit about each component of the test or each marker, each sections, and also tells the risk associated with one of them, with all of them, and also the food you should be eating. So for instance, if you come to me like, I have diabetes, and I check your alpha-lipoic acid, it tells you what alpha-lipoic acid is and how it is important for body function, for your body to operate. What you can expect when you optimize this: energy, antioxidant, insulin sensitivity. So we need to use alpha-lipoic acid when we want to get off diabetic medications. It tells you high, like what could deplete your alpha-lipoic acid. High biotin, right, can compete with alpha-lipoic acid. And levels of optimal levels may improve blood glucose and insulin, cognitive function, and then the food you should be eating. Now, there's a lot of the food that are recommended in this test that I don't recommend for my patients, like oat, but there are a lot of foods in here that we should be eating, like peas we should be eating, broccoli, if you don't get bloated, you should be eating, healthy, lean, organic meats we should be eating, Brussels sprout, if you don't get bloated, you should be eating. But it tells you a lot. So if you were to look at glutathione, glutathione is important for detoxification in the liver. It also is an antioxidant as well. And deficiencies, causes can be happening due to stress and lifestyle changes, high fat diets, inflammation, infection can decrease your glutathione. And then it gives you the risk associated with low glutathione, impaired immunity, and the food you should be eating. But we definitely can eat poultry. We don't do milk, we don't do cheese. In America, this dairy is very, very toxic, creates food sensitivities and gut issues, but there are some things you can use here. So what I do, I take this test and I customize it for my patients. I give them a dietary portion that is good for them. So, but this goes into B vitamins, all the B vitamins you should be replenishing. And it goes into magnesium, minerals. This tells you about your omegas, amino acid. There's a whole section on probiotic, digestive enzymes, mitochondria, toxic exposure, methylation. A lot of people have the MTHFR gene and the COMP genes. It tells me, and then there's a whole section on the gut, organic acid, looking at, again, malabsorption, dysbiosis, yeast infection, neurotransmitters for those of us that suffers with ADD, ADHD, serotonin for sleep. So there's a lot. And amino acid, if you're losing and you want to build muscle, this test tells you a lot. Like I can do a whole video about this one. This is how we identify the root causes. By doing this test, you can identify the root causes. I'm gonna stop sharing. If you don't do any of these tests, you only do the lab coat, because it's covered by insurance, you are missing out. You're missing a big piece to healing your body. And then, yes, be okay with being frustrated, because that's what's going to lead to frustration, anxiety, confusion, desperation, despair, depression. And you're going to keep seeing all the doctors, trying to get all the solutions, and nothing will work. I just showed you 3 tests that is super important that you can do today with your doctor, tomorrow with your doctor, or with me. If you're looking to identify the causes, schedule an appointment. We have all our links in the comment section below or in the note section below. We'd love to help you. I would love to help you, whether in the state of New Jersey or you're out of state. We do telemedicine, virtual medicine, and these tests, many of them, we can ship the kit to your house. I can mail the lab coat script. I can literally get you some answers. And we're all looking for clarity. Clarity is important. If you're not clear on what's causing the problem and what to do to fix it, what's the opposite of clarity? Confusion. So I tell my patients, I understand there's a financial component, but the best investment you can make in yourself right now today is the investment of working with a doctor that does functional medicine testing to help you. So that's what I have for you today. I would love to support you on your journey. If you know anyone that can benefit from this information, please share it with them. And if you are curious about any of the testing we just mentioned and you want to go deeper by doing any of the tests, schedule consultation. We'd love to help you. We need to talk first to see which test is appropriate for you, which test is the best for you, so that you can have the right testing, right recommendations, and also to minimize the high cost that many people occur in functional medicine. All right. So thank you so much. If you can subscribe, share this video, share this message with all the people, because so many people are suffering. And I'll see you on the next video. Bye.